Online. Darren, thanks for your time and welcome to the program. What do you envision to be some of the weaknesses in our rollout system as we prepare to receive these vaccines tomorrow?
Well, firstly, the story that I've done is nitpicking, but we need to nitpick because, we're on the cusp of rolling out the world's most sought-after commodity. As we're seeing around the world, it's going to be in short supply, which opens up the possibility of massive profits for organized crime groups. We've already had a case of falsified vaccines disguised as cosmetic injections entering our country as far back as November, apparently via Singapore. The police managed to trace to a warehouse in Germiston. Our market is attractive to criminals because compared to the rest of Africa, we're high income. Sooner rather than later, our vaccines are going to end up at public facilities where, sad to say, medicines have in the past been stolen. In fact, we've still got a problem with criminals phoning their collaborators in certain hospitals with orders for specific medicines. We're a country with high rates of corruption. We've seen that with the PPE scandal. And, of course, we have a big criminal presence here in South Africa. So given the context that I've sketched, our authorities should be on high alert. They say we are. We've got a good health minister. We are backed by some of the best scientists in the world. We've got a good health products regulatory authority, a good technical and logistics team in charge of the vaccine rollout. Now, it's going to be pretty terrible if their efforts are undermined by corruption and criminality. And it would be great if they were supported by the best supply chain security system.
Right. We've been told before that the vaccines will be tracked through some kind of electronic system that will ensure that we're able to see, essentially from when the vaccine arrives to when it arrives in somebody's arm. But does the system go far enough in making sure that these vials are essentially visible throughout that process?
Now, at the risk of oversimplification, let me try to put this in a nutshell, and I'll base it on the information that has been given to me by supply chain security experts around the world.
Yeah.
Our health department is going to be using the electronic verification data system, the EVDS. Now, on paper, it's very good, but it's essentially a digital verification data capture system. It's not a security system in the true sense of the term. The patient, in this case, you and me, will get the vaccine. We'll be registered on the system via a cell phone. From there, by means of data inputting by the person dispensing the vaccine, the EVDS will record the type of vaccine we've been given, where it was given, its batch number, patient details, any adverse reactions by you or I. Yes, now, this does offer a measure of security and patient safety, but it does not offer a full track and trace capability to safeguard vaccines. That, however, is offered by a system developed by an international firm called GS1. It has developed a medicine security system that has been endorsed by the World Health Organization and the World Customs Union to protect vaccines by means of what's called data matrix barcodes. A scan of such a barcode by someone with access to the GS1 system will link to an international database. This will throw up red flags if there's been a problem somewhere in the world with a particular medicine, with a particular vaccine. If there have been recent problems with falsified vaccines, for example, emanating from a particular source, the system will tell the user that, and due caution can be used. So, in effect, the GS1 system allows for eyes to be on products everywhere in the supply chain, everywhere in the world, which obviously greatly minimizes the possibility of bad medicine, if I could put it that way, entering the health sector. Now, just lastly on this point, what's important to realize here is it's not me saying that the GS1 is the best system. The government said this itself in 2017 when it published a notice in the Government Gazette declaring its intention to invest in the GS1 system because it was the best way to ensure patient safety with regard to medicines.
Yeah, and that clearly hasn't happened yet. But what many might find quite bizarre is that we actually can't trace any medicine, let alone the COVID-19 vaccines. In other words, this actually isn't new.
Look, this sounds worse than it actually is. We have a great regulatory authority in SAHPRA, the South African Health Products Regulatory Authority. They are backed by forensic units from the different pharmaceutical manufacturers that we have in South Africa. On the face of it, they're doing a good job. However, Andy Gray, who's in pharmacological discipline at UKZN. He's also linked to the WHO. He is one of the country's foremost medicine authorities. He says it's not known, because of the system that we currently have, which isn't ideal. It's not known how much falsified medicine actually there is at any given time in our country, because we don't proactively sample the markets. We leave it up to the manufacturers to investigate if there are problems, and they're the ones who investigate. So what Andy is telling me is that, our reliance on good manufacturing practice to keep fake medicines out of the country could mean that we are missing problems that are occurring. But I think, based on what my sources have told me, that South Africa is pretty secure with regard to the falsified medicines issues. Our systems are pretty strong, not ideal, but they're good. Our problem could be coming in with regard to, our problem could be theft, basically.
Yeah. And, tracking the vaccines is one thing, but being able to know quick enough that vaccines are being stolen is another. And the sense I'm getting from you is that we actually wouldn't be able to respond quick enough in the event that these vaccines are even stolen.
Look, I do think that the first million vaccines that are coming in now are going to be ultra safe. The problems, I think, are going to come in when we are all used to vaccines being rolled out. That is when guards are going to drop. That is when we're going to see criminals having worked out the systems, having worked out the routes, where these vaccines are going, how it's working. They already have their collaborators in the hospitals. Let's not shy away from that fact. It's difficult to say in these times when we've got nurses or in the front line, so to speak. But it's a fact that we've had these problems before. We still have problems with theft in hospitals. And as soon as people start getting used to where the loopholes are, that is where the problems could come in.
Absolutely. Well, thanks for giving us a sense of what you know. As you mentioned, I think there's a whole host of interest now, and the possibility of this sort of thing happening perhaps isn't that likely. But as time goes on, the situation might leave a lot to be desired.